Lifestyle Medicine for COVID-19 and NCD Care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors: the Pascual Pharma Corporation, the Omron, the Taisho Pharmaceutical. Simply
Our vision is to be distinguished as a fast-growing Filipino pharmaceutical company, advancing a legacy that provides reliable, high-quality health and wellness that are responsive and relevant to the changing needs of patients and customers. Blumea balsamifera sambong leaf, Relief Forte. The longer, the better. Relief Forte, relief for urinary stones. The only prescription-grade L-carnitine available today. Enhance your heart score with Carnicor. Brought to you by Pascual Pharma Corp. Building a legacy of care.
Dr. Anastacio Castillo graduated from Iloilo Doctors College of Medicine and trained in internal medicine at the Iloilo Doctors Hospital Incorporated. He completed training on basic and advanced courses in ambulatory diabetes and is a member of the Institute for Studies on Diabetes Foundation Incorporated, as well as the Philippine College of Physicians. He is a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. Currently he is a Medical 3 officer at Republic Pedro Trano Memorial Hospital in Gimbal, Iloilo, and a co-founder of the Holistic MD Philippines. Dr. Anastacio Castillo will be discuss on lifestyle intervention, the COVID-19 and NCD response.
67% and 27%. In the next 30 minutes, I will prove to you that these two numbers are actually significant. These are the percent of NCD deaths in the Philippines based on the WHO NCD Progress Monitor of 2020. 67% is the country's percent of deaths from NCD, and the total number of NCD deaths are reported for 2016. On the other hand, 27% is the percentage risk of premature death from target NCDs in the Philippines, dying between ages 30 and 70 years from the 4 main NCDs. With a benchmark of WHO numbers, we are clearly above global rate in terms of NCD deaths. I don't have any disclosures. My name is Dr. Castillo, and I would like to thank you for your time, and it's a real pleasure to be here. I will be sharing some usable information about lifestyle intervention, the COVID-19 and NCD response, because with a number of available interventions and informations we all know about NCD, you might be interested to hear that there is actually an effective response to help our NCD patients while we are all challenged with the COVID-19 pandemic. The most common non-communicable diseases in the Philippines are linked by four most known preventable risk factors related to lifestyle, namely tobacco use, unhealthy diet, lack of physical activity, and alcohol use. These lifestyle oversights results commonly to cardiovascular diseases, cancer, chronic obstructive pulmonary diseases, and diabetes mellitus that afflict millions of people and account for the highest global morbidity and mortality. Maintaining a healthy lifestyle and nutrition are the foundations for the healthy living and are vital in prevention of non-communicable diseases. From malnutrition, obesity, cardiovascular, nervous system, chronic kidney diseases, HIV, AIDS, and even tuberculosis. All these non-communicable and infectious diseases are currently succumbed to reallocation of resources to test and treat COVID-19 patients. From an economic perspective, the COVID-19 pandemic has resulted in the surge of unplanned government expenditure, which further strains the efforts to address the urgency of NCD burden. Now, let me ask you some questions. First, how can we reduce the risk factors of NCD patients now that our healthcare system is focused in the treatment of COVID-19? Second, as a healthcare provider, what is the most cost-effective response to continue NCD care while we are still facing COVID-19? I'm going to park this for a while, and let me get back to you with a more concrete answers as we go through the whole presentation. But before that, let's take a look at our current situations of NCD patients dealing with COVID-19 in the current times. We all know that people with NCD are at higher risk for complications and death from COVID-19. Although all age groups are at risk of contracting COVID-19, older people face significant risk of developing severe illnesses if they contract the disease due to physiological changes that come with aging and potential underlying health conditions. Studies of critically ill COVID-19 patients have identified higher proportions with at least one NCD. Hypertension and cardiovascular diseases were found to be the most prevalent pre-existing conditions, followed by diabetes. People living with 3 or more comorbidities, accounting for the 48% of COVID-19 mortality in Italy, appear to be at the highest risk of death from COVID-19. Obesity is one of the underlying health conditions that can cause a more severe reaction to COVID-19 infection and has been shown to be an important risk factor for worse outcomes. Smokers appear to fare comparatively poor among hospitalized COVID-19 patients. One study found that smokers have 14 times greater odds of developing COVID-associated pneumonia than non-smokers. There is evidence from the USA and Europe that illustrates a higher prevalence of severe cases of COVID-19 in areas with high levels of air pollution. Viral infections can be harder to treat in people with diabetes due to fluctuations in blood glucose levels and possibly the presence of diabetes complications. Firstly, the immune system is compromised, making it harder to fight the virus and likely leading to a longer recovery. Secondly, the virus may thrive in an environment of elevated blood glucose. People in active chemotherapy or intensive radiotherapy, those who undergone antibody treatments, or other targeted treatments, or those who have undergone bone marrow or stem cell transplants in the last 6 months. They are particularly vulnerable as these treatments weaken the immune system. Evidence indicates that COVID-19 and its treatments may also cause life-threatening or long-lasting impacts, as well as respiratory impacts. These complications from COVID-19 include cardiac injury, acute kidney diseases, neurological malfunctions, blood clots, and damage to the liver and intestinal function. As governments reorient health systems to respond to COVID-19, there are severe disruptions to the delivery of routine chronic care, such as potential blockages in supplies of essential medicines and technologies, screening and diagnosis, and limited access to resources including health workers and support services, critical for ongoing management of NCDs. Particularly in LMICs or low to middle income countries, vast numbers of LW NCDs or people living with NCDs are undiagnosed or cannot access treatment to control their conditions, even under normal circumstances, may be high risk from COVID-19. Due to postponement of routine procedures, disruptions to care, and travel restrictions, there are increased obstacles to individuals self-managing their NCD conditions. Due to disruptions or suspension of routine services such as NCD screening and diagnosis, as well as disruptions in access to treatment and medication. There may be aftershocks to some health systems as people present later with symptoms of more advanced diseases such as late-stage cancers, uncontrolled hypertensions, chronic kidney diseases, and others. While the impacts of health systems in high-income countries are unprecedented, the worst impacts are expected to be felt in lower-income countries with already severely under-resourced health systems. The COVID-19 pandemic and its response pose a challenge to mental and neurological health and social well-being. Governments must ensure access to mental health and psychosocial support services based on respect for human rights and make them available in community to protect and promote the mental and neurological health of the population. Responses to COVID-19, including physical distancing and self-isolation, may increase exposure to some NCD risk factors such as increased alcohol and tobacco use as coping mechanisms, barriers to physical activity and healthy diet, and more. And now, we need to establish the link between COVID-19 and NCDs and learn the lessons we can apply from one over the other. The COVID-19 pandemic exposes the existing link between NCDs, communicable diseases, and health emergencies, and the need to stop addressing health issues in silos. Both COVID-19 and NCDs are indiscriminate killers, reinforcing one another and disproportionately impacting the poorest communities around the world and the most vulnerable people in every country. Such link is that major NCDs increases likelihood of severe or fatal outcomes of COVID-19. The latter also introduces conditions that are likely to become NCDs. They both share common risk factors that reinforce adverse health effects, and thusly, both are driven by the common upstream determinants of resources. Through the causative agent SARS-CoV-2, COVID-19 spreads quickly in a community and overwhelms the healthcare system if left uncontrolled. However, as the pandemic is prolonged, we are gaining a deepened understanding of the various links between COVID-19 and NCDs. Both COVID-19 and NCD exerts immense consequences but chronically, We should recognize that NCDs are imposing enduring and profound adverse health and non-health effects. Like COVID-19, NCD caused disruptions to society and economy. The approach of NCD should target overarching systemic forces and environmental drivers. Some of the upstream determinants of the spread of COVID-19 through measures such as community support for lockdowns and social containment, national and local infection surveillance and reminder systems, concerted multi-sectoral activities for rapid detection and contact tracing, quick installation of temporary shelter hospitals and communal isolation facilities, and free timely treatment for COVID-19 in the health system. Some of these measures aiming at wider determinants of health in the context of COVID-19 are transferable to the arena of NCDs and should be highly regarded as future guidance for activities targeting NCDs. A multi-pronged preventive and treatment measures, the effective and cost-effective preventive measures, should continue to be prioritized in addition to treatments for NCDs. Like the control of COVID-19, the control of NCDs required tiered multi-pronged strategies that encompass both effective prevention and treatment. Preventive measures deserves particular attention. Although they are often ignored due to the requirement for long duration and their less obvious immediate effects, the precautionary principle should be proactively followed. The precautionary principle deserves attention in certain scenarios of NCDs, despite the need for evidence-based practices. The quick suppression of COVID-19 application reflects the merits of the precautionary principle in public health when facing uncertainties around the benefits and risk of interventions. Strict precautionary measure may prove to be particularly relevant for controlling infectious diseases in the earlier stages of transmission. This was demonstrated by the COVID-19 containment due to early and quick lockdowns, social distancing, and a wide use of face masks in some countries, despite the lack of initial evidence for their effectiveness. A vision for planetary health instead of a restrictive perspective, the onset and development for COVID-19 pandemic against the backdrop of global climate change and environmental degradation encourage us to broaden our view of health issues. Since NCDs can be regarded as a socially transmitted conditions, and since many infectious diseases become a chronic with a lingering health consequences, the dichotomies of infectious diseases and NCDs need to be removed in order to reflect the common nature and roots of human health issues. Causes of major NCDs can be traced to a number of underlying determinants: common risk factors and intermediate risk factors, poverty, social exclusion or lack of resources, urbanization, and population aging are global scenarios that leads to common risk factors such as unhealthy diet, physical inactivity, tobacco, and alcohol use to be on the rise in the population. These common risk factors give rise to intermediate risk factors such as high blood pressure, elevated blood glucose, abnormal lipid profiles, and overweight or obesity. These intermediate risk factors then predispose individuals to a fatal for cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes mellitus. The Western Pacific Regional Action Plan, or NCD, utilizes a comprehensive approach that simultaneously seeks to effect change at three levels. At the environmental level, through policy and regulatory interventions, at the level of common and intermediate risk factors, through population-based lifestyle interventions, and at the level of early and established disease. Through clinical interventions targeted at the entire population through screening high-risk individuals for the risk factor modification and persons with established disease for clinical management. To support change in these three levels, additional actions are needed in the following areas: advocacy, research, surveillance and evaluation, leadership, multi-sectoral partnerships and community mobilization, and lastly, health systems strengthening. However, let me pause for a while, as this material will only focus on lifestyle intervention, as it is considered as the first-line therapy in the treatment guidelines for many chronic diseases conditions. The core interventions are changing the behavior, looking at the built environment, and the integration of information and education to lower the risk factors of NCD linked towards COVID-19 upstream determinants. Now, let's take a look first of the tips on how to maintain a healthy lifestyle and what is our role to ensure that we reduce the risk factors of NCD in this time of COVID-19. The health workers play a central role in operationalizing the framework of NCD prevention and control. We need to institutionalize planning for promotion of healthy lifestyle. Assessment and planning is a precursor to an effective implementation of NCD prevention and control program at the local level. Every locality is encouraged to undertake their own assessment of the current situation of NCDs in their area and identify the major risk factors exposing their population to NCD diseases. This is critical in the selection of interventions in response to their identified needs and particular situations. The plan for healthy lifestyle must be integrated into a current developmental plan of the local government and embedded into the investment plan for health in order that efforts for healthy lifestyle will gain equitable support from various investments. LGUs must be provided with a guide on how to assess NCD-related issues and planning parameters to consider in selecting and designing appropriate interventions. Lifestyle intervention. It is defined as any intervention that included exercise, diet, and at least one other component, such as counseling, stress management, and smoking cessation. Whereas behavioral interventions are interventions designed to affect the actions that individuals take with regard to their health. These interventions encourage people who are at high risk of particular disease to do something about it. And for the behavioral intervention, let's focus on the two achievable interventions that we can manage as healthcare provider and considered as the most cost-effective intervention for people with NCDs. Number 1, promotion of behavior change, and number 2, behavior change tools. Promotion of behavior change. Awareness of risk associated with behavior alone is not enough motivation to change the behavior. Changing behavior can be extremely challenging. Many theories of behavior change exist. Among the most common related to health behavior change are the trans-theoretical model of behavior change, the health belief model, and social cognitive theory. These common theories of health behavior change will provide series of processes and tools that can be used to apply in our clinical practice. Starting off with trans-theoretical model of behavior change. This model of behavior change was first used to describe tobacco use and cessation behavior. The model describes the continuum of stages in behavior change. For example, the patient has cardiovascular problem due to smoking. The clinician's strategy is to increase the awareness of the need. for change through personalized information about the risks and benefits of smoking cessation. If the patient intends to take action, its strategic action is to motivate, encourage, and assist the patient in developing and implementing concrete action plans and help set gradual goals. Once the patient has completely changed the behavior, the strategy is to assist with coping reminders, finding alternative in avoiding slips of relapses. In the event of a relapse, one thing to do is to frame the relapse as a learning opportunity in preparation for the next action stage. The health belief model of behavior change is a psychological model that attempts to explain and predict health behaviors. This is done by focusing on the attitudes and beliefs of individuals. The health belief model predicts that behavior is a result of a set of core beliefs, which have been redefined over the years. The original core beliefs are the individual's perception of: number 1, susceptibility to illness such as chances of getting lung cancer is high. Number 2, severity of illness such as oral cancer is a serious illness. Number 3, the cost involved in carrying out the behavior such as stopping smoking will make one very irritable. Number 4, benefits in carrying out the behavior such as stopping smoking will save the patient's money. And lastly, cues to action, which may be internal such as the symptoms of breathlessness, or external like the information in the forum of health education leaflets. For example, if an individual experiences hyperglycemia with cessation of exercise and has a family history of dialysis and a kidney transplant secondary to uncontrolled diabetes, the individual may have increased motivation to restart their exercise routine. The threat in this example is hyperglycemia and the possibility of a kidney failure. The behavior is exercise, which the individual believes that from a personal experience has an effect on blood sugar control. Taken together, the threat and the knowledge of benefit from exercise may increase motivation on the part of the individual to change the behavior. Social cognitive theory, specifically social learning theory, suggests that motivation to change behavior is increased when the subject believes the behavior is important and has confidence that they can successfully change the behavior. When we apply the example from the health belief model, the individual with hyperglycemia is aware that both increased physical activity and reduction in carbohydrate consumption can lower blood sugar and reduce her risk for kidney disease. Because she has exercised regularly in the past, she is confident that she can make this change again, but is less confident about reducing her carbohydrate intake. Because of the difference in her confidence to change the two behaviors, social cognitive theory suggests that she will be most successful when initiating exercise because she believes she can modify this behavior. This theory is important to consider when developing a lifestyle medicine plan and setting patient-specific goals to modify behavior. Another important behavior change concept lies in the technique used to deliver appropriate behavior change interventions. Motivational interviewing is a form of patient counseling that has been found to be effective in reducing maladaptive behaviors and promoting positive health behavior changes. The approach focuses on eliciting a personal intrinsic motivation to change, rather than advice giving or confrontation from a health professional authority. Key to this counseling technique is displaying empathy, rolling with patient resistance, and supporting self-efficacy. Displaying empathy can be done through reflective listening and by vocally acknowledging the difficulty in behavior change. Rolling with resistance involves the absence of confrontation and in its place discussion of new perspectives or alternative solutions for barriers to change. Finally, supporting self-efficacy can be done through assuring the patient that you believe in their ability to make the change. Motivational interviewing is a skill set that develops with knowledge and practice, and is extremely advantageous in effectively using the behavior change tools. Self-care monitoring is an important piece of behavior change. Self-monitoring not only increases personal awareness of behavior and its effect on health indicators, but also enlists joint participation in behavior modification on the part of the patient. Literature exists suggesting that self-monitoring in itself is therapeutic, and through the process of self-monitoring, desired behavior increases and undesired behavior decreases. 1. How it works. Next, what is self-monitoring? It's a term used for tracking your health behavior. Another, how do I self-monitor? Pick a health behavior to focus on and record your daily actions. Some common examples include keeping a detailed food journal, weighing yourself weekly, recording your exercise. Another thing is how to get started. Pick the health behavior to be tracked. Determine system for recording it. Regularly record your behavior. Review your journal regularly. And lastly, analyze your behavior and make changes if needed. Important components to consider. Number 1. Truthfulness. Honesty is the best policy with self-monitoring. An honest record will help you accurately assess your behavior and make a game plan to achieve your goals. Number 2. Consistency. Regularly keep track of your behavior. It is very important. The only way to detect routines, patterns, or see your progress is if you are consistent. If you miss a few days, you start tomorrow. Number 3. Timeliness. Recording your behavior when you perform it will help you keep accurate records. Maintaining good control of NCDs and COVID-19 risk factors among patients is important, but health service provisions during outbreak is very challenging. 2 more scales of lifestyle intervention that are specific responses for NCD and COVID-19 risk factors. Improving the built environment and information or education. Because close to 90% we spend indoors during post-COVID. We need to be informed on the risk factors of NCD and COVID-19 as we adjust to this new built environment and learn the effective prevention treatments from the community. In the absence of a specific vaccine to the coronavirus, physical distancing and lockdown of the population are among the most immediate and precautionary measures to be taken. Since most humans spend most of their lives inside the built environment, it is essential to understand the potential transmissions dynamics of infection. As individuals move through the built environment, COVID-19 can be transmitted both by air and via direct and indirect contact. According to the affected lifestyle, the increased reliance on digital channels in the built environment may endure long after pandemic and affect in every design and urban aspects. Humanity is facing a global crisis, perhaps the greatest of our generation. Many measures adopted during the emergency will become a part of daily life. Changing habits and behaviors, they may be positive or negative, intervention in architecture and urban planning approaches. While there are many potential impacts of COVID-19 on built environment, our focus in the following points is on how the post-architecture may change. Although social distancing and quarantine measures are extensively adopted as the first preventive measure, other factors increase the risk of contracting the virus. The built environment has a large impact on the prevention and containment of both chronic and infectious diseases in humans and in non-humans. The effects of the built environment on health can be direct, for example, by influencing environmental quality, or indirect, by influencing behaviors that impact disease transmission and health. Furthermore, these impacts can happen at many scales, from the individual to the society, and from the design of the place we eat from, to the designs of the cities. Number 1. Population density. In our current health crisis, certain densely populated cities have proved to be particularly vulnerable to the risk of infection. Number 2. Household size. A big household, large or extended families, will have a higher chance to bring the virus home. This will need special consideration in design solutions to prevent infection. Number 3. Social distancing level. Working from home might reduce social contact, but is only available to some people focused on job linked to a higher socioeconomic status. Moreover, stay-at-home regulations would be more than a challenge for those who live in smaller and crowded houses or without outside spaces. Number 4. Shared facilities. Shared housing includes a broad range of settings with special considerations. People living and working in this type of building might have challenges with social distancing to prevent the spread of COVID-19. Number 5. Housing characteristics. With a stay-at-home attitude essential to COVID-19 response, housing characteristics takes on added importance in people's lives. Extended time indoors could raise various challenges in the design of post-pandemic housing because we are forced to stay and work from home. Post-pandemic house and office space will witness a great transformation because we will be more aware of the functionality of our homes and workspaces in an interestingly new approach. Given the growing public health burden of COVID-19 and NCD, which disproportionately affects those with low educational attainment, there is an acute need to promote the reach and effectiveness of prevention treatments in diverse populations. We need to intensify health education and public information. Prevention of NCDs banks largely on success of changing poor health habits and practices into healthy lifestyle. Health promotion efforts will take various forms in order to effect change in lifestyle and behavior. These include 1. Information, education and communication, intervention measures both for the individuals and the general public. 2. Social mobilization that include the generation of participation and involvement of the community, service providers, program managers, and other partners in making key decisions. Assessment and planning, implementation and monitoring of NCD-related efforts. And 3. Advocacy among mandated agencies or institutions and concerned officials for direction and support. Key messages appropriate for each targeted group must be defined and geared to changes in behavior that are desired. On the other hand, misinformation and fake news on social media platforms are fueling the panic. People should follow information from trusted sources like government guidelines. In addition, authorities should disseminate the appropriate information to the general public in a timely manner. To answer these posed questions earlier, as to question number 1, we've already established that NCD and COVID-19 are driven by common upstream determinants, and in this current situation, they both compete for resources. Major NCDs increase likelihood of severe or fatal outcomes of COVID-19, and COVID-19 induces conditions that are likely to become NCDs. Our response to the COVID-19, including physical distancing and self-isolation, may increase exposure to some NCD risk factors. Thus, we need intensely our intervention of promoting healthy lifestyle, such as increased alcohol and tobacco use as coping mechanisms, barriers to physical activity, and healthy diet. And as for the question number 2, as a healthcare provider, in this time of crisis, wherein resources are funneled towards one goal only for COVID-19, the best alternative and the most cost-effective intervention is to reshape the behavior of our patients and adopt healthy lifestyle, as it is critical to slow down the risk factors of NCD and COVID-19 from the onset and exacerbation. COVID-19 is one of the most challenging public health emergencies within the century. Although most countries are still in the midst of the crisis, we are optimistic that COVID-19 will be contained in the foreseeable future, as has already been achieved in some countries. However, success stories are rare for NCDs, and they will continue to pose major challenges to all countries. The intersection between COVID-19 and NCDs reminds us of the upstream determinants of health in our society. This reflection reinforced the WHO's recommendation to address most modifiable lifestyle factors such as tobacco use, excessive alcohol, unhealthy diet, and physical inactivity for the prevention and control of NCDs. This recommendation is operationalized by the healthcare providers in the management of the risk factors through an effective lifestyle intervention. This intervention can be directed in modifying the lifestyle behaviors and considered as the most cost-effective and preemptive way of intervention. Changing these behaviors could prevent a majority of premature chronic diseases with the environmental and education influences. Behavior change, however, is a complex process and can be frustrating to both the patient and the healthcare professional. Several tools exist to assist in this process. Many of the tools described practically apply one of the 3 common health behavior change theories. The use of these tools in clinical practice may increase the rate of success in modifying lifestyle behaviors and, in effect, reduce the risk factors of NCD and COVID-19. And I'm gonna leave you out with this funny meme I saw online. We all see ourselves in this situation. Once again, thank you. Be safe, everyone.
Lifestyle medicine for COVID-19 and NCD care, a wake-up call.
Our vision is to be distinguished as a fast-growing Filipino pharmaceutical company advancing a legacy that provides reliable, high-quality health and wellness that are responsive and relevant to the changing needs of patients and customers. Blumea balsamifera Sambong leaf. Relief Forte. The longer, the better. Relief Forte. Relief for urinary stones. Acetylcysteine, Acetimax, dissolves mucus to the max. The number one 50 mg sildenafil brand in the Philippines and the most prescribed sildenafil citrate in the market. Zilden, now on its 10th year. Manage your BP. Protect your kidney. Like a pro. Irbipro, the certified safe irbesartan. The only prescription-grade L-carnitine available today. Enhance your heart score with Carnicor. ACE inhibitor enalapril is recommended by the ESC for heart failure with reduced ejection fraction. Enalapril maleate high pace. Keep their hearts at pace. Eliminate potassium loss worries during diuresis. The only furosemide with potassium. Diamide K, ang furosemide na may K. Pregabalin Pregasafe with AAA effect, analgesic, anti-epileptic, and anxiolytic. Pregasafe, no pain, all gain. Fluocinolone acetonide, Aplocin, the reliable topical corticosteroid for acute and chronic dermatosis. Aplocin. Brought to you by Pascual Pharma Corp. Building a legacy of care.
Our gut is home to trillions of living microorganisms. In order to live, multiply, and perform their functions, they need to be fed sufficiently. Or else, they'll look for other sources of food within our body, which will eventually make us sick. Fruits and vegetables contain prebiotics, such as fructooligosaccharides, the right food for our gut bacteria. However, proper amount may not be acquired through natural food only. Hence, supplementation is needed too. Foligo is an all-purpose prebiotic powder that can be added to commonly consumed food and drinks, hot or cold. Each sachet contains significant amount of pure and highly concentrated fructooligosaccharides for prebiotic supplementation. Fructooligosaccharides are generally recognized as safe and has been proven to promote growth of beneficial microbes in our gut, resulting to healthy digestion, absorption, and elimination of food. Additionally, it enhances production of metabolites that are beneficial not only to the gastrointestinal tract, but also to distant organs and body systems. A well-fed gut will also improve immunity and decrease the risk of allergy, reducing the overall risk for a wide array of chronic diseases. Feed your gut with Foligo.